Niacin, in high therapeutic doses, holds a powerful and well-documented ability to improve cholesterol profiles, significantly reducing LDL, bad cholesterol, raising HDL, good cholesterol, and lowering triglycerides. Decades ago, it was considered one of the first effective treatments for dyslipidemia and remains one of the few agents capable of boosting HDL to a meaningful degree. Yet despite these benefits, niacin has fallen out of favor in modern clinical practice. The reasons lie not in its efficacy, but in the evolution of pharmaceutical alternatives, the medical system's intolerance for side effects, and a larger trend of overlooking older, nutritional interventions in favor of newer, more profitable drugs. Mechanistically, niacin's lipid-lowering effects are remarkably sophisticated for a simple vitamin. It works by inhibiting hepatic diacylglycerol acyltransferase 2, DGAT2, an enzyme critical to the synthesis of triglycerides in the liver. This leads to reduced production of very low-density lipoprotein, VLDL, which is the precursor to LDL cholesterol. At the same time, niacin slows the breakdown of HDL, leading to elevated levels of protective cholesterol. These dual effects, lowering atherogenic particles while increasing protective ones, made niacin a uniquely comprehensive therapy in the era before statins became dominant. However, the clinical use of niacin in this context typically involves high doses, often 1,000 to 3,000 milligrams per day. At these levels, side effects become more common, most notably the infamous niacin flush, a temporary, often uncomfortable sensation of warmth, tingling, and skin redness caused by vasodilation. Though harmless, this flushing can be intense enough to deter patient compliance, especially when compared to statins, which are generally easier to tolerate in the short term. Non-flushing versions of niacin, such as inositol hexanocotinate, have been marketed but tend to be less effective at altering lipid levels. Eventually, the widespread adoption of statins, supported by large pharmaceutical trials, strong marketing, and more consistent tolerability, eclipsed niacin's role. Statins were easier to prescribe, had fewer immediate side effects, and fit neatly into the cholesterol-centric model of cardiovascular risk management. But what was lost in this transition was a broader understanding of lipid modulation and metabolic support. Niacin not only affects cholesterol, it also improves endothelial function, reduces inflammation, and lowers lipoprotein A, a risk factor not targeted by most statins. These additional benefits have largely been ignored or downplayed in the rush towards standardized pharmaceutical approaches. More recent trials, such as the AM-HI and HBS2 Thrive studies, further contributed to niacin's decline by suggesting limited additional benefit when added to statin therapy. However, these studies had notable design limitations. Many participants already had near-normal lipid profiles from statin use, leaving little room for niacin to show further improvement. Also, side effects such as skin reactions and glucose intolerance became a focus, leading to an overly cautious stance on niacin's use, despite decades of earlier data showing cardiovascular benefit, especially when used as a primary rather than an adjunctive therapy. Today, niacin is rarely prescribed for cholesterol management, and its reputation has quietly faded in clinical circles. But this obscurity doesn't reflect a lack of value. In individuals who cannot tolerate statins, or those with unique lipid challenges such as low HDL or high lipoprotein A, niacin remains a powerful tool, albeit one that requires thoughtful dosing and monitoring. It is also a potentially beneficial adjunct in metabolic syndrome and pre-diabetic states, where its NAD-boosting effects may offer systemic improvements beyond cholesterol. In the broader sense, niacin's fall from grace is emblematic of a deeper issue in modern medicine, the tendency to abandon older, natural, or nutritional therapies once newer pharmaceuticals dominate the landscape. The medical system is biased toward innovation, often mistaking it for progress. But in doing so, it can lose sight of inexpensive, well-understood, and multifunctional tools like niacin, tools that offer far more than symptom control. Niacin is not just a lipid-modifying agent. It is a molecule that supports metabolism, repairs DNA, modulates inflammation, and sustains vascular health. To reframe niacin purely as a vitamin is to grossly underestimate its therapeutic potential. In the right context, with the right knowledge and care, it remains a valuable part of the cardiovascular toolkit, one that deserves far more attention than it currently receives.